So varicose and thread veins are common. They are bulging veins which people will regularly see on the skin. They are bigger than the normal size, maybe uh, green veins, which people may or may not see. Um, they they do start off in early adult life, and in some patients they progress over time. Perhaps the most important lead to it may well be a familial predisposition to it, rather than necessarily what people stand for a long time, as was thought in the past. Right. So many times, varicose veins can cause aching in the legs. They can cause itching. Uh, they can cause the legs to be heavy. They can cause leg swelling and rest leg, uncomfortable legs, and also just as they can be unsightly, causing concerns to the patients. They can become complicated, resulting in thrombosis and painful clotting off of the vein. They can bleed excessively if not, and they on a few of them may well progress to changing the color of the skin, making it darker, and rarely you can have ulcerations forming around the area of varicose veins. But these are not as common. This is really more when the venous insufficiency takes hold on the skin rather than just purely the varicosities alone. Right. So starting with the thread veins, they are fine veins. They most often we will, if we're going to treat them as compared to just leaving them alone, we will tend to inject them in the clinic setting with agents that would irritate the veins and cause them to shrivel away. That's the mainstay of what we actually do for them. Um, For varicose veins, usually we will get a scan to see whether the truncal veins, especially the long and short saphenous veins or the perforators, are involved in causing in the course and progression of the varicose veins. And we'll also check whether the deep venous system is open and unaffected before we deal with the varicosities themselves. For the varicosities, we aim to remove them either by making little stabs to pick them off or by injecting them. But we also need to deal with the truncal veins if the valves are not functioning properly. And for that, we'll use minimally invasive catheters, which may be a laser catheter or a radiofrequency catheter to heat the vein up and that way shut it down. This is in preference to the old dissection and stripping the long or short saphenous vein, which we gave up quite a few years ago, except on the occasion where that's really necessary. So that's the mainstay of what we do for them. In a smaller percentage of patients, we may inject these veins as an alternative, but the outcome of that is probably, although it's less invasive, the outcomes are not as good as surgically taking the veins away. So the recovery, certainly in our hands, tend to be pretty good. There are day case procedures, which will send you home on the same day. We encourage you to walk and move around as much as possible from day one. We discourage use of lying down and in bed, nursing it. So it's really activity from day one after surgery. most people are able to return to what they normally do within a few days of the operation. You will normally have compression stockings for a week or two after the operation, which is helpful. And in the long term, the vast majority of our patients will not need anything more doing after the initial operation. If they have a few thread veins, which we don't normally deal with at the time of surgery, we could inject those in clinic, but the majority will not need anything more doing. In the years to come, new varicosities can form, really in keeping with the way that varicose veins form, that actually some people are predisposed to having these veins. So new veins can form, but if they do, the treatment tends to be smaller than the original operation. I'm more than happy to help with that. But the vast majority should be okay from their first treatment. On the understanding that a lot of these things are there's a familiar predisposition. I doubt that you can actually stop the vein developing entirely, but you can reduce the propensity for them to do so or become larger or be symptomatic by using, for instance, compression stockings or avoiding prolonged standing. Or if the legs are aching, you may need to elevate them for a little time just to get some relief. But the reality is that if you do have incompetent valves and varicosities, the best way to approach it is really to get the veins removed and get the long saphenous or short saphenous, the truncal vein treated. The treatment is a day-case procedure, and on the whole, it tends to be much less of a hassle than many years of wearing compression stockings and worrying about elevating the legs and things like that.